Meanwhile, folks, the chiefs of Operation Warp Speed saying today that they're ready at the drop of a hat to get the vaccine to the American people. The Department of Defense relaying this confidence, that they can roll out these doses week after week without stopping. At the same time, though, we're also getting more good news from AstraZeneca Oxford vaccine that their trial here in the States is going very well. But where do we stand on this? The nitty-gritty of bringing life back to normal. Health and Human Services Secretary Alex Azar joins us now. Secretary Azar, thank you very much. The first question is always about who gets the vaccine first, since we know there will be a limited amount. Has that been worked out? Who gets it first and why?
Well, Charles, we're still working on the prioritization as we look at the data, but you should be thinking about groups that are the most vulnerable, whether it's our seniors in nursing homes or those with comorbid conditions that make them particularly vulnerable to serious complications, or our healthcare frontline workers and first responders. Those are the types of groups that we have spoken about as in those first tranches of distribution. But that product is just going to keep coming off the manufacturing lines, and we'll just keep expanding the groups and availability of vaccine week after week, as General Perna from the Defense Department has talked about.
Now, the concern is now sort of focused to the nitty-gritty, the nuances, really, of getting that vaccine out. I mean, from the refrigeration requirements to equipment like special gloves. Has all of that been accounted for? Is the money there? Is the manufacturing happening?
It's all there, thanks to President Trump's Operation Warp Speed. You know, when we built this system back earlier this year and partnered with the Defense Department to lead it right away, General Perna and the OWS team contracted for needles and syringes and dry ice and diluent to mix the vaccine, personal protective equipment. So we now have 100 million kits already prepared and ready to marry up with approved vaccine to get out there, and we're building more as we speak. So all of those complications, all of those details have been worked out by the incredible logistics, operations, and distribution team that we have in Operation Warp Speed. And, you know, the core to it, Charles, is we're relying on existing tried and true systems. We're using the private sector. We're using the infrastructure that gets vaccine out there, not just every day, but every year, whether it's flu or other vaccines to the American people.
Yeah, the flu shot, everyone in this country is encouraged to get it. It's always available, although I think there might be greater challenges considering the composition of some of these early vaccines that are seeking approval. You know, I guess at some point we'll have them right in the syringe. But when you start talking about distribution also, what I'm curious about is I know the federal government Operation Warp Speed has been extremely successful. But what about states? What responsibility falls on them once the state gets its hands on this vaccine? And by the way, on that note, has New York formally requested the vaccine yet?
New York hasn't necessarily formally requested it. We're going to work to make sure New Yorkers get access to the vaccine unless there's some barrier imposed by the government of New York. But this vaccine is going to be available to all Americans who are prioritized. We're working in close collaboration with the New York team that have an excellent distribution plan that they've submitted to us and worked with us on under their health commissioner's guidance. So we're doing that in all 64 jurisdictions we work with here in the United States. The role of the states here is, think of it as more of an air traffic controller, telling us where do you want the vaccine sent to. That can be one place, it can be 5,000 places. They just have to be enrolled in the system. In addition, we rely on the states to make sure that their IT systems are up to date, and we've provided funding and expertise and the data systems to do this, because we need to make sure if somebody gets a Pfizer vaccine first, they get a Pfizer vaccine second, whether they're in New York or if they've gone down to Florida, they'd always get the same from a protection of patient safety. But we bought the vaccine. The vaccine's free. We're paying for the administration costs. We're paying for the distribution costs. We're paying, as I said, we built the kits that go with in terms of syringes and needles and the equipment needed to vaccinate. We've set up the partnerships with CVS and Walgreens and America's community pharmacies, our community health centers, our hospitals, to make this feel to you as much like the flu vaccine experience as it can be.
I know, I think I've read anywhere from 120 to 160 companies working on vaccines. The mRNA has been the most successful so far, but there are also other approaches that are being taken too. Are they all benefiting from the same changes that have been made at the FDA to expedite something that would have normally taken 3 years?
They are, and in fact, that was one of the geniuses of Operation Warp Speed, is we invested in multiple platforms. So the messenger RNA one, which is the Pfizer and Moderna platforms, but also the adenovirus platform. So that would be the AstraZeneca platform, Johnson & Johnson, and then the subunit protein platforms, Novavax and Sanofi Pasteur, which we hope will enter into phase 3 clinical trials soon. So we spread our bets around with multiple platforms, and fortunately, the mRNA ones seem to have definitely paid off, and we saw very positive news from AstraZeneca on the adenovirus platform out of the UK and Brazil studies just on Monday.
Well, Secretary Azar, I do want to say thank you very much. Congratulations. No matter what happens, history should look at Operation Warp Speed and how the administration and yourself, the involvement you've had, because this is something that's been done to the benefit of all mankind. So I just want to say thank you.
Well, Charles, and I want to, on this Thanksgiving, I want to express my thanks to President Trump for his unqualified support of Operation Warp Speed, and then for the American heroes who were leading it, and America's biopharmaceutical industry, and especially to all of our clinical trial volunteers who've participated in these clinical trials. Thank you, Charles.